Hi, I'm Karim Baroudi, Hancock Public Health Commissioner. And I'm talking to you this afternoon to give you a quick update as we usually do on Mondays and Thursdays. Today I want to start with the summary of our situation here in Hancock County. As of now, we have 22 confirmed cases of COVID-19 and 2 probable cases. I want to talk a little bit before we move on about what's the difference between a probable case and a confirmed case. Like we were reporting all along, confirmed cases are cases who were tested in a lab to confirm the presence of the virus. The CDC late last week, changed their case definition on how to identify cases. That case definition, changed a little bit to include probable cases. So what's the difference? Probable case is a case who was a close contact with a person with symptoms and who were tested positive for COVID-19, and or combination of clinical criteria, symptoms that the provider can look for, and other things that can classify that person being probable. So moving forward, I think you're gonna see on our dashboard, on our website, on our Facebook, two numbers of confirmed cases, and those are the cases who were lab tested, confirmed positive for COVID-19, and the probable cases, those are cases who are probable and presumptive positive. Now, from public health standpoint, both of those numbers would be followed upon the same way as positives. So we will do contact tracing, we will follow up with the individuals who are presumptive positive, just like as if it is a positive test. Now, this is all new. We talk about that a lot, and this is something we have to get used to. And as the science and the research are finding more ways to identify cases so we can do some containment, I think we're moving, with the guidance of the state and guidance of the CDC as far as reporting our cases. So as of today, we have 22 confirmed cases, 2 probable, and so far we have 1 unfortunate death. We talked about the probable and the confirmed cases. I want to talk to you a little bit today about telehealth. A lot of your providers, the hospital providers in town, as well as providers of mental health services and addiction, are all moving most of their services into telehealth, where you can call in or video in your provider and consult with them that way. To be honest with you, this is a great way to do it. It's easy. I want to encourage a lot of you for minor things where you don't need to present yourself to the hospital or your doctor. Call in and take advantage of telehealth. It's as easy as calling a friend, or FaceTiming a friend, or videoing a friend, and they'll be able to walk you through some of the symptoms or some of the things you want to consult with them about. Again, this is a lot of information also available on HancockHelps.org. A lot of resources. I encourage all of you to go there and find what you need. It has a really comprehensive list of services available to you in this crisis. I want to talk about community connection. You know that public health is coming up with the initiative that every week we'll do something different for the community to keep connected. Since we are staying at home, we want to keep connected. And I say it again and again, they want us physically, or that virus wants us to be physically separated, but we have to keep connected at one point. And I think this week, the idea is to get connected through Hearts for Hancock. We want you to find the hearts to put on your windows. They can be cut out hearts, stained glass, however you want to do them. Just put them out in the windows so people can see them, and they can to show your support for everything everyone is doing. Every and each one of you is doing to make sure we don't spread the virus in our community. And so far we're doing great. It's very important to continue, and that's why we want to show support through Hearts for Hancock. And like every week, we want you to take pictures, take little videos. If you see a heart in the window, and make sure you post that at hashtag HancockCountyStrong. This way for the whole community to see it and for the whole community to see how we are all in this together and how we are all coming together to make sure we come out okay at the end. I want to thank you for staying at home. I want to thank you for sending only one person to get the essentials. We are still under those orders. If you've been watching the last 24-hour news cycle, we're talking about recovery. I want to assure you that we will follow with the guidance of the state and the federal government as we come up with plan for recovery. Again, the call center phone number is 419-425-9999 if you have a general question, and the triage at Blanchard Valley phone number is 419-423-7890. I want to thank you all and be well.